Hello, my name is Dr. Jeff Gross of ReCELLebrate, and thank you for joining me for my Upgrade You talk. I am honored and pleased to have been invited to speak here at the 10th Biohacking Conference. Thank you, Dave. I'm out of Las Vegas, Nevada area, actually in Henderson, Nevada, a suburb. I'm speaking on the current state of regenerative medicine in the US, and this includes a discussion of stem cell-based therapies and other regenerative biologics, including stem cell-derived exosomes. And we'll go through this and explain it, and by the end of the talk, you'll either have a medical degree or at least know about this material. But we're going to talk about what is now available in the US and what is coming. Now, many people can benefit from both the restorative and regenerative benefits from stem cells and related regenerative biologics like exosomes. We do have the eternal blueprint in our cells to heal and regenerate. We use that quite a bit when we're young, but sometimes later in life we need a little help. It doesn't work quite as well. You think about a 3-year-old, maybe you have a child or a nephew or niece or something that scrapes his or her knee on the sidewalk and has a scratch, and mom cleans it up, puts some Bactine, a Band-Aid on it, kisses it, sends them on their way, and 3 days later it falls off in the bathtub, the Band-Aid does, and the scab is almost completely healed. But you look at a 65-year-old who bangs his or her elbow on the door jamb, and there's a bruise there for 2 weeks. Why can't we as older adults heal like we did when we were younger? The same person, the same DNA, the same cell makeup for the most part. Well, there are reasons for that. And when we speak to regenerative medicine, what we are talking about is tapping back into that youthful healing biology of what our cells did in the first place, and their ability to help renew, heal, and replace our damaged cells. That's where we get the name regenerative medicine. So a few points now. We do maintain stem cells in our body. They're not just there when we are a fetus and a newborn and a child. We maintain them throughout our life, and we maintain their activity throughout our life, but it's just not as great because as we age, and during this aging process in time, we're exposed to the pro-oxidants of our environment, which cause inflammation and damage. And these could be, what's in our food source, our water source, our air, electromagnetic waves, and so forth. And our cells and our stem cells are affected by these damaging forces and become less efficient at doing what they used to do so well when we were young. Even our stem cells can become senescent or zombie cells, not just our regular cells. And of course, the more zombie cells we have in us, the more zombie we are, meaning the older and more biologically aged we are. So let's look at some concepts, some key concepts, in fact. Our cells collect and must defend against damaging forces in our environment. And that's really the essence of cellular or biological aging. We call it also inflammation. This is the root cause of most diseases, not all, and inflammation has a direct role in cellular aging and therefore our aging. And to slow this process, we need help from biological signaling in our body through stem cells, through our own stem cells to start, and maybe help from others, which we'll get into shortly. As we become less efficient at repairing and regenerating and even signaling, we get help from the younger regenerative biological products, stem cells being one of them. Now, what is a stem cell and where do they come from? Well, a fetus is made of them. And you start as an embryo, you're all stem cells. Those stem cells give rise to other cell lines. They form organs, they form limbs, they form the baby that's born. They also have a role in developing the placenta, the umbilical cord, and all of we'll call it the birth products, the related organs. And these come from various tissues in our body after we're born. They get stored there, mainly in our fat and bone marrow. Bone marrow being the source of many different kinds of cells. For example, new red blood cells, new immune cells, and many others. Now, when we change our oil in our cars, we don't put the old oil back in. So I'm not a huge fan of using one's own stem cells, particularly an older person's stem cells, putting them back in that person. Now, there are benefits from procedures like that, but we can do even better, get into youngest, most fresh material. And where do we get these? They're from donors. And these come from C-section births. And instead of discarding what used to be medical trash and is now medical treasure, we take the placenta, the umbilical cord, and the Wharton's jelly in the umbilical cord, and the amniotic fluid, and all the cells and signaling particles in that fluid and those tissues, and save them. And these are the youngest, most active groups of stem cells, and they have not been exposed to damage. They have not been exposed to radiation and chemicals and pesticides and all kinds of bad things in our environment to cause inflammatory defense systems to act up. They're fresh and unadulterated. So these are the best, most useful types. And it occurred to me early in my residency that there is something magic about amniotic fluid. And what the observation was, it was around about the time that we were starting to do what are called in utero surgeries. We would see a mother who sadly had an ultrasound that showed the baby had spina bifida in the womb, which is an opening of part of the nervous system along the spine, usually the lower back. And there was benefit in closing those openings in terms of the child's later ability to develop, good functioning of the legs and bladder and things like that. So there was a procedure through a scope where you would actually go into the belly and into the womb and, basically sew up this opening, this spina bifida. And it was very interesting because then we'd leave the uterus and get out of the woman, and then later she would give birth, usually by C-section. And this picture scaled out improperly, but this picture shows there's minimal, if any, scarring. And how amazing is that? You have this opening of the body, this hole you shouldn't have. You have sutures used to sew it up, and the scar is not there. So there's something magical about this amniotic fluid. And as you study amniotic fluid, or as I did, you find out it has abundant youthful stem cells. It has proteins, collagen, growth factors, and extracellular vesicles. Now, this is the first time you're going to hear that phrase, extracellular vesicles. But these things, proteins, and remember, small proteins are called peptides. These are growth factors. These are cell signaling things. It's for one cell to talk to another cell. It influences what's going on in the genes of that cell, what proteins are being made, what that factory is supposed to be doing. And extracellular vesicles are going to come in here, very important, very, very quickly here. But let's go a different direction for a moment. What happens to stem cells that are delivered to our bodies? Let's say we take some stem cells from a donor and we give them to you. You go somewhere, you get an IV, you get a bunch of stem cells loaded up in you. What happens? Well, turns out they have some benefits for you, but they only last about 10 to 14 days. But interestingly, the benefits often last much longer, many weeks longer, sometimes even months. And that's very interesting. If the cells are gone, what's doing all the work? And this is where we figure out that those stem cells must be imparting some chain of events, some signaling of information to our own cells, including our own stem cells and our regular cells, to carry out the job of what those stem cells are doing. So that's very interesting. So whereas these stem cells that you're getting, if you're getting them, are really delivering something, and you can just figure out what that something is, and we have. And it turns out those are called exosomes, and that's short for extracellular vesicles, which we heard a few slides earlier. And that's the main source of signaling from one cell to another. From one cell to tell its neighbors, hey, I'm infected, you guys should help fight the infection with me. Or, hey, everything's going great, you should do this great stuff with me. It's sort of like a neighborhood watch program. Now, we call these MSC-derived exosomes here in the US right now. MSC stands for mesenchymal stromal cell. It's kind of a type of stem cell, which is basically the most common cell found from these birth products. And these are available from US donors, just like stem cells are. These are samples that get fully screened and tested for all diseases, so we make sure we have a perfectly clean and healthy tissue. And they are interestingly supplied by FDA certified and compliant labs. And the donors that we use have not been exposed to COVID vaccine. Now, that's not a political statement, although it could be. But because we just don't know the long-term effects of the COVID vaccine, we don't want to take any chances. So we are avoiding that at this time. And as I mentioned, cells communicate with each other, and that communication turns out to be the key when you get a stem cell treatment, for example, how it's affecting your cells. It's delivering a signaling. So these are usually by the peptides I mentioned, which are small protein fragments. Most growth factors and small cell-to-cell hormones or paracrine, we call those paracrines, are also in the peptide family. But also by vesicles. And vesicles are encapsulated proteins, peptides, growth factors, and microRNA. These are about 1/1000th the size of the cell. I like to say they're small. Now that's almost silly, right? Because cells themselves are small, but remember, cells are measured across in diameter by microns, which is 1 × 10⁻⁶ meters. But these extracellular vesicles, aka exosomes, are 1/1000th the size of that. So 10⁻⁹, we also call them, that's nanoscale or nanoparticles. And each cell can make thousands of these. So if you get a stem cell delivery, you can have basically a delivery. Each cell is producing thousands of these exosomes to travel into your tissues doing the work. So where stem cells are the delivery, the exosomes are kind of the actual medicine of sorts. And all cells make extracellular vesicles, even injured and damaged and senescent cells. But the MSC, the stem cell derived exosomes, send a healthy signaling message to their neighboring cells to take these cells busy dealing with inflammation and turning them into restorative, regenerative, healing powerhouses. Okay. Now, interestingly, these encapsulated exosomes have a little bit of a membrane, like a cell membrane. They, as this diagram shows, they can be sent out of the cell, and they're also brought into the cell to deliver their cargo in the same but opposite way. So we use the word exosomes. Somes is bodies. Exo means out of. So out of the cell come these small bodies, and all cells make them. But again, it's the active mesenchymal stromal cells or stem cells that produce the MSC-derived exosomes that's signaling the neighbor cells, including neighboring stem cells where they're delivered, to participate in a similar activities, similar anti-inflammatory, anti-degenerative cascade of activities inside the cell, basically influencing the cell what to do when it's not doing it as well as it used to. And other sources of exosomes would be PRP, platelet-rich plasma, have some, stem cells have some with them and also make them, but you can also just filter them out of amniotic fluid and some of the umbilical cord fluids. And these are very unique. Now, don't worry about the busyness on the cell unless you're a molecular biologist or have a background like that. But inside an exosome, you can have microRNAs, which are very small RNAs that make certain proteins. And these proteins, in this case, when they come from a mesenchymal stromal or stem cell, are an anti-inflammatory restorative signal. They can include a lot of different growth factors, and some of them are the very primitive survival growth factors like heat shock proteins, the same heat shock proteins that are released when you spend 20 minutes or more in a hot sauna of 175 degrees. So these are those very pro-health, pro-regenerative growth factors. So if you want this signal to get into your cells, you can't eat a pill of heat shock proteins. You can't just inject heat shock proteins into your bloodstream. It would get dissolved. The proteins would get, the peptides would get digested. But if they're encapsulated in a delivery vehicle like a cell-made extracellular vesicle or exosome, then your cells will get these. They're, as you know, anti-aging. They have epigenetic influence. So, epigenetic activities, lifestyle changes can influence your own cells making these as well. Now, the beauty of exosomes are they can pass into the brain. Stem cells cannot. But wait, doc, we've heard stem cells can help Parkinson's and stroke, and it can, and the reason is those stem cells get into your bloodstream, produce exosomes, those exosomes then cross over to the blood-brain barrier. That's how that works. The pores in the blood-brain barrier are the right size to allow exosomes to pass, but not stem cells. Exosomes are immunoprivileged, as are stem cells, meaning there's no really reaction against the graft or rejection. They sort of evade the immune system. And when you get them IV, they're not preferentially taken up by the heart and lungs, and they penetrate tissue better, which is not the same for stem cells themselves. So how do these exosomes work? As I mentioned, they deliver their contents to our cells, into the cells. Some of those molecules get into the nucleus to influence what DNA is involved, because we want all the healthy, regenerative, youthful DNA to be more active. The same genes are in the senescent cells, but those genes are turned off. They're just sitting there dormant. So it's the same computer code, just depends on what program we're running here. We want to run the regenerative program, not the degenerative program. It switches our cells, when you get these, from a defense inflammatory mode to an optimal functioning restoration, healing, anti-inflammatory mode. Those words go together here. And this is the essence of regenerative medicine. This is how it works, and anti-aging medicine as well. The MSC-derived exosomes are basically hitting a factory reset to our cells, making them work like they did when they were fresh out of the womb. They improve what we call cellular metabolism, the activities in the cell to behave like they were fresh and unadulterated. I call this stem cell activation because exosomes can influence our dormant bank of stem cells to wake up and act like they did when they were young, right? So did you ever notice, by the way, observation that a pregnant woman has healthy glowing skin, great hair, and often, except maybe some back pain from carrying the baby, they don't have a lot of pains and they're in good mood, not a lot of joint pains? Well, the reason is they're getting a daily dose of exosomes from the womb. Other examples of exosomes in our world that we don't even think about. How about bone marrow or bone broth? And a lot of plants have plant-derived exosomes. You know, when we eat our green powders or our supplements, we're getting exosomes from the plants. Those have an effect upon our cells, even though we're many species apart of an evolutionary chain. Chicken soup. Why does your mother, grandmother in most cultures make you a chicken broth or chicken soup when you're sick? Because it comes from the chicken stock. The bone marrow of the chicken cells is rich in exosomes. And how about colostrum? One of the ways colostrum works is delivering growth factors from a lot of exosome, and also in mother's milk there are still exosomes being delivered, even though colostrum is much richer in those types of regenerative things. So let's compare stem cells versus exosomes derived from stem cells. And as you can see, I feel, and there's nothing wrong with stem cells, but I feel exosomes are a more efficient way to go because it is not the delivery mechanism, it is the end product, whereas the stem cells are the delivery mechanism. The risk of rejection is small or de minimis in both. IV distribution, stem cells are big in sticking. When you get them IV, they can get hung up in your heart and lungs because think about it, goes up your vein. The first place it goes is your heart. Heart gets a lot of it. It goes to your lungs. Lungs gets a lot of it. Anyone here who's ever had stem cells, and I've tried them IV, your heart just goes like it's on fire for a couple weeks. So you know your heart's getting a lot of it. Exosomes are so fluid and distributed in the IV. They travel better throughout the body and they penetrate tissue better. And as I mentioned earlier, they pass into the nervous system, whereas stem cells really don't have much. Exosomes are easier to handle and store at minus 30 C in a clinic versus minus 80 C. Exosomes are much more cost effective compared to the cost of stem cells. So what are we doing with exosomes now? Thought you'd never ask. Okay. Well, let's start out with some regulatory information here because I'm educating today. I'm not providing medical advice to individuals, but the FDA does have the authority from Congress to regulate marketing claims. This is spoken and written claims of drugs and medical products, and they don't regulate what doctors do or what patients want and receive. That's between the doctor and patient relationship. The FDA has not yet approved claims. Focus on marketing claims. They have not yet approved marketing claims that can be made regarding regenerative biologics. That includes stem cells, exosomes, even PRP. They have not disapproved them for claims either. They're sort of in a limbo. So not yet approved is not equivalent to unapproved. And for example, PRP is not approved, but even now health insurances are starting to pay for them. So why? Follow the money. They found it cheaper and easier based on the benefits than surgery and repeat cortisone injections. But on May 1st of this year, interestingly, the state of Utah took a big step and legislated the approval of regenerative biologics in their state, even though it's not FDA approved. So we have this civil war again, just like we do in a lot of states with marijuana laws, where the feds say no, but the states say yes. So ultimately here, it's a myth that you hear this, oh, it's illegal to have stem cells in the U.S. It's not. It's illegal to have exosomes in the U.S. It's not illegal. There's no crime being violated. Now, if a doctor or someone makes a claim that it can cure or treat a disease or condition, then they are non-compliant with the FDA, way the FDA decides what's approved and unapproved by that. And that's usually based upon scientific literature and studies. But the FDA tends to disregard over 2 decades of work in Asia and Europe and other places. So this is the problem, right? They get to decide when it's adequate and when it's not. So a lot of the things we do in my clinic are based on good science. We're not shooting from the hip. Based on follow-up studies, clinical studies, papers where these products have been used to help people. Currently available applications for using exosome. Now these are just the main ones. There are others. We find new ones every day. Let me move my picture out of the space here. But the low-hanging fruit is joint osteoarthritis. I'm going to go into quite a bit of detail about what we do in a little bit. And this helps with cartilage regeneration and healing, helps prevent surgery, hopefully. Osteoporosis, we found that exosomes can improve bone density. That's both through IV and sometimes in the bone injections. We find improvement in cell metabolism, like certain cells, like pancreas cells for insulin sensitivity. Cellular functions are improved by that signaling method we talked about earlier when we went through the first 10 minutes of the biochemistry lesson here. That also involves organ dysfunction. We've used exosomes to help people to slow or reverse kidney failure, try to keep them away from dialysis. We also see improvement in glands like dry eye syndrome. Injecting the meibomian glands in the eyelid can improve the production of the oil those cells make to help keep the tears from evaporating. We have P shots and O shots for sexual function, and we have some cosmetic and skin procedures and hair. As long as there are follicles, we can help slow and reverse the inflammatory damage that's causing the hair loss. We really see benefits also in hyperinflamed states like autoimmune dysfunction, and we'll go over a list of those in a moment. We also see people who just want peak performance, athletes and anti-aging biohackers, improvement with HRV, exercise tolerance, recovery from workouts. We also use exosomes to help people recover from a health event like a stroke or heart attack, to reduce the inflammatory phase of that and improve function. We also should include traumatic brain injury there. And I mentioned earlier osteoporosis, but also age-related bone density loss and muscle atrophy, which are related to frailty. And improving and maintaining our structural tissues keeps us moving, keeping us moving, keeps us younger. All right, so why did I, an old doc like me, move from traditional medicine to regenerative medicine? Well, I'm a spine fellowship trained neurosurgeon. I still love the spine. It's why I, went into neurosurgery and pursued a fellowship and treat neck and back pain. But over the years, it occurred to me with the help of my patients that there was a big gap. And that gap is there wasn't much we could offer people short of surgery, and a lot of these surgeries are big and barbaric, if they weren't responding long enough and adequately to physical therapies, chiropractic care, other types of rehabilitation, and maybe some anti-inflammatories and even some spinal injections. There's a big gap between those things and surgery, and most people come and say, yeah, I still have neck and back pain, it slows me down, but I'm really not ready for surgery. I say, yeah, I get it. I really don't want you to have surgery. And patients would say, how about something else, doc? What do you got? You got lasers, you got stem cells, and you hear that enough times, and chance favors the prepared mind. So I had a background undergraduate in biochemistry and molecular cell biology, so I really wanted to see what had happened in the 25 to 30 years since I had gone to undergraduate school. in the field of stem cells. So I went, instead of going to the annual spine conferences, I went back and retrained in regenerative medicine. And it's not just for the spine, it's for so many more things now. And I can see this is most of what I'm doing these days and love it. Yes, there are political and economic pressures that wish to maintain the status quo. They want us doing surgeries with metallic rods and implants. They want us prescribing medicines. That makes people money, but it's not best for patients. We should push off surgeries and pharmaceuticals for the cases where we have no other options. So as I told you, I'd spend some time on structural elements since I come from that field, the spine. But most of what we do and get the earliest and best results seem to be with the joints. They're kind of the low-hanging fruit of regenerative medicine. And this is for something called osteoarthritis. And usually it gets worse with age. It's painful. It slows people down, which reduces their muscle mass. They can't move as much and exercise as much. It reduces their bone mass. It's circling towards working against longevity, against health span. And injuries also can accelerate this process. And it turns out that it's not just the wearing and tearing of the cartilage. It's actually a metabolic bone problem. And we've learned that the healthier you are, the more supplements, vitamins, and I've listed some at the bottom here, and anti-inflammatory epigenetic lifestyle changes you have, the less painful osteoarthritis you have, the less degeneration, because there's inflammation in that bone. And when those bone cells are inflamed, they can't produce the cartilage or maintain the cartilage. And the cartilage is where we get the cushioning and the lubricated movement of the joint. So when we're young, we maintain these joints. And remember, the joint was created when you were a fetus and a young child. It was created by the bones. The cells in the bones made the cartilage. They made the surfaces. They made the lubricating fluid. Okay? And some of those cells that make cartilage are called chondrocytes. And they produce proteins, fancy proteins that include collagen and all kinds of glyco-based proteins that make the cushioning of the joints and the surfaces of the joints. So the cartilage is the surface. Then you also have some lubricating fluid called synovial fluid. Most of our stem cells in the bone reside in the marrow. And remember, that key marrow at the tip of the bones that made that joint in the first place is called the growth plate. So when we lose the ability to produce, renew, maintain, or make that cartilage, those proteins, when those chondrocytes are so inflamed and give up, then you start to lose that cartilage and the bone starts to get inflamed and rub on each other, and that's called arthritis or osteoarthritis, or you've heard bone on bone or wear and tear. Also, doctors might use the term chondromalacia. You might have seen that before. And there are stages of chondromalacia that radiologists will tell you if they look at an MRI. 0 is where you have really no degeneration, and then 1 is a little degeneration, and so forth. And you go all the way to stage 4, which is the worst. That's the bone-on-bone stage. We have some x-rays at the bottom, and you can see x-rays are harder to tell because you're just looking at a gap. You can't see the cartilage. MRI is really the thing. But the bottom line is everyone thinks this is a cartilage problem. It's not. It's a bone problem. How do we know that? We look at MRIs. So we can see this is a knee. This is the bottom of the long leg bone called the femur. You can see this bright, cranky, inflamed area in this part of the knee with thinning of the cartilage right next to it. This is exactly what we're talking about. A normal one is over on the right. This is what it should look like. The gray in the bone and the tibia bone down here, but here you see very cranky bone and thinning of the cartilage. This is exactly what's going on in the bone that's causing the problem of the degenerated joint. Now, joints do not have a lot of cells. As I told you, it's mostly proteins. The cellular activity is in the bone, the chondrocytes, and the stem cells are in the bone. The blood flow comes from the bone. The nutrients come from the bone. So if the problem's in the bone, why are we doing all these cortisone injections in the cartilage of the joints? Well, why? Because it helps make it feel better for a minute, but it's not treating the problem. In fact, we know that repeat cortisone injections can make it worse. So I draw from Professor Dr. Philippe Hernago from University of Paris East, and he's an orthopedic surgeon, and he had a landmark study that you should know about. They took 20 patients almost 20 years ago. Yes, they've been doing this a long time. Sorry, not 20 patients. I think it was 100 patients 20 years ago. And these patients were already offered joint replacement for their knee. They had stage 4 bone-on-bone osteoarthritis. They had a lot of pain, trouble walking. They needed a knee replacement, right? He said, wait a minute, before you do that, would you like to join my stem cell study? We're going to take stem cells, because remember, they didn't have exosomes at the time. They had stem cells which make exosomes. We're going to take stem cells out of your bone marrow. So not only did they use stem cells, they used the old recycled stem cells from the same person. We're going to take your stem cells, and half of you are going to get it injection in the joint, in the cartilage, and half of you are going to get injection in the bone where we see this inflammatory change. And he called that the subchondral bone, meaning just under the cartilage. Okay? And the results are amazing. So at the 15-year follow-up, which was the last report on these patients, we're waiting for the 20-year report shortly. This is the graph. Now I added some colors and cleaned it up for us, but this is from his study. On the bottom you see this would be time of the injection right here, the 5-year mark, the 10-year mark, and the 15-year mark. And going up here is a survival plot. 100% survival meaning you did great after the injection. You didn't, we were able to treat the pain, not need the surgery. And if you maintain that benefit, you get to stay up here on this plot. If you lose the benefit, then you fall down. That means you've fallen, your joint didn't survive. And at the 5-year mark, they both had great results, right? You had almost 100% of the bone injected group, the subchondral bone, they were still doing great. And about, I don't know, was this 80%, low 80% or high 70% of the joint injected groups were doing great. Both great results, but clearly the bone group was better. At 10 years, a lot of those joint injected groups called intra-articular injection were doing worse, and only a few of the bone injected groups started to have problems with their knees again. And you can see now much greater difference between this is probably in the low 90% survival of those knees, not of the patients, of the knees. And here you see about half or just under half of them were remaining. And at the 15-year mark, it's even more stark. They noticed we had about low 80% of the bone injected group were still doing great. That means, like 18% of them started to have problems again at 15 years. And in the joint injected group, they're below 25% were remaining. So it's clear that there's a substantial difference. And if you inject the bone, you're going to get not only better results, but much more long-lasting results. Now, you might say, well, these guys who are falling off the curve here, can they go back and do it again? The answer is yes, but this study wasn't for that purpose. But this is why I do bone injections and don't waste my time with joint injections. I want longer lasting results from the same injection. And of course, we're using younger material, and not only younger material, we're using the exosomes, so it's more cost efficient. So the take-home lessons here is the vast majority of those suffering from painful degenerative joint problems can improve enough to avoid surgery. And this is by addressing the bone problem, the bone marrow cells, reducing the inflammation by giving a signal through exosomes to have those cells behave more youthfully, regenerative, restoratively. Does this improve the cartilage? Well, let me show you. The patient of mine here, we did an MRI in March of 21, prior sports injury, prior arthroscopic surgery for skiing problems, skiing injuries. The radiologist read this as grade 2 to 3 chondromalacia, there's that word again, of the medial femoral condyle. So that's the inner component of the knee. And then also behind the kneecap, this patient had trouble walking up and down stairs, was real stiff after sitting, and had before walking had to loosen up, had a grade 2 chondromalacia of the surface behind the patella. The patella is the kneecap. This is a side view of the knee. I'm circling the kneecap. This gray structure is the cartilage that kneecap rides on when you bend your knee. It's kind of a gliding cartilage surface. So we did exosomes into the inflamed part of the knee and the patella to address both of these areas. and the patient did great, had the initial anti-inflammatory benefit where pain was reduced, but it never went away because there was a regenerative benefit. And out of curiosity, in October of 22, which the injection wasn't even done until June of 21, so we're talking about a year and 4 months later, out of curiosity, we repeated the MRI and didn't tell the radiologist anything, so it was sort of a blinded read. And this is the result we got back: mild cartilage irregularity. So remember, it went from grade 2 to 3 of the meniscus immediately and grade 2 of the kneecap. Here, they didn't even grade it. So I think at worst, it's a grade 1. So we've improved the knee, we've reversed the degeneration, we've reversed the wear and tear, we've reversed the bone-on-bone and osteoarthritis. And in the side view picture, which is supposed to be the best approximation of this view, you can see the thickness has improved of that cartilage. She has regrown the patellar surface. And I tried to do a blow up here for you, and I put it in yellow. This yellow became thicker. So she regenerated her cartilage in her joint. So if you think this is, nonsense or silliness, I've got other MRIs for you. So yes, we can help someone regenerate cartilage by addressing the bone. These were bone injections. And with it, help reduce pain, reverse the degeneration, improve the function to keep this person moving and keep the muscle mass and bone density good for health span. And often it just requires the one time. How long might it last? Well, according to Philippe Hernegau's study, 82% or so lasted 15 years. So, but I'm using exosomes and a more youthful source. I hope they last even longer. Ask me in 20 years. This is how we make surgery the last option for joints and spine, and there's no reason why someone shouldn't be looking at the option of regenerative medicine first. Okay, it's certainly a lot easier to do. There's no downtime and just soreness for up to a week. And here's kind of how it looks. We do it once we know on the MRI where to go, we use fluoroscopy to go into the bone in the procedure center. We do an MRI beforehand, of course, and we use the highest resolution, which is 3 Tesla. A few academic centers have a 7 Tesla MRI, and we use special sequences called inversion recovery that are non-standard to really look at this. We do the bone injection under sedation, not general anesthesia, just a little twilight. There's no downtime. You can go right back to work. We have people fly in and fly out the same day or next day. And where else besides knees? Well, ankles, elbows, hips. I've done painful fingers, toes, shoulders, and the spine. Here is an MRI showing inflammatory change in the spine. When the discs wear down, the bones don't like it. They get cranky. Above and below this disc, you can see cranky bone, and that's my target for treatment. Here's another example here. This is the bone marrow change in the vertebra. And the health of the disc comes from the vertebra. You can see these discs are almost completely collapsed compared to these neighboring discs. This is a lower back. And we go right into the bone and deliver the exosomes. It takes 15 to 20 minutes per level. Because degeneration, if we've learned anything here, is not just structural. It's not just loss of the height of the cartilage. It's a metabolic process involving the cells and stem cells in the bone. And when we can approach this from a restorative way and regenerate, we are reversing the opposite of regeneration, which is degeneration. Did you catch that? Regeneration is the opposite of degeneration. So with our exposure to the world and what we do every day and the wear and tear, we are slowly degenerating. A lot of us are here to learn how to degenerate more slowly or stop it or reverse it. Well, to reverse it is to regenerate, and that's where exosomes and stem cells and regenerative biologics come in to help that. So let's talk about some of these other things we can do with exosomes for cellular health, which is also the anti-inflammatory effect. The MSC-derived exosomes can encourage the glands to function more optimally. That could be the pancreas and diabetes. It could be the kidneys and renal failure. The liver, we spoke about the dry eye syndrome and other glands. And also for post-irradiation syndrome, I've had people have had their salivary glands that got damaged. Maybe they had radiation for a thyroid tumor or something, and they stopped making saliva. It's hard to digest. Well, we might there's some literature and there's some injections to the salivary glands to help reanimate that activity in the cells. Also, immune system function. And stimulate the bone marrow, the stem cells in the bone marrow to produce more white cells and healthy cells to fight infection. Cellular health and anti-inflammatory effect could also be the neurologic system, cognitive results. We see that in people who have this IV because, remember, exosomes cross the blood-brain barrier. We see it in other metabolic issues like leaky gut, toxin exposure, because these cells are damaged and we're helping to restore some of the reparative and anti-inflammatory effect of the cells. And it can help you with resilience and tolerance in a preventative way. A lot of people for biohacking and anti-aging properties like that. We also have great results helping people with hyperinflamed states called autoimmune diseases. That includes rheumatoid arthritis, irritable bowel or Crohn's disease with or without psoriasis or other skin manifestations, thyroiditis, including Graves' or Hashimoto's diseases, lupus, scleroderma, vasculitis. MS has an inflammatory component that we can address, myasthenia gravis. Anything with an inflammatory component, exosomes and regenerative biologics work against because they're naturally anti-inflammatory. And we also can deliver exosomes through an inhalational model, a breathing machine, a little nebulizer for chronic bronchitis or certain allergies, syndromes, or asthma. We've helped people go from oxygen dependence to independence. We have help with type 1 diabetes and certain neuropathies. Also related to inflamed states would be certain infections like Lyme's disease and COVID-19 are known to be significantly high on the inflammatory scale. We also have seen some benefits in addressing the symptoms of long COVID. So therefore, regenerative biologics are the most powerful and natural anti-inflammatories. They work on the source cell activities, what DNA is being used to make genes, what proteins are being made, what those cells can signal their neighbors to do, and this is working against the source, not the symptoms of inflammation. So a lot of the medicines we take fight the symptoms. And remember, age is accumulated chronic inflammation. Some people call this inflammaging. And the changes are vast. They can be in appearance and how you feel, the energy level. And if you're good with epigenetics and really working hard on lifestyle and avoiding exposures to bad foods, bad water, bad electromagnetic waves, and you work hard at it, you can reach a youthful, not just looking, but a youthful functioning, a less biologically aged body as other people age into their later decades. And this is one way we will extend health span and, as Dave says, live beyond 180. So you can also use regenerative medicine to help you achieve those benefits that cannot be helped by other forms of epigenetic activity. I suppose we could say exogenous regenerative biologics, when taken by someone, is sort of a form of influencing what genes are available or being transcribed. So of sorts, that is an epigenetic influence. Diseases with inflammatory components at the cellular level are also called age-related diseases because aging and inflaming are almost synonymous. So you could call these age-related diseases or disease-related aging. It's the same thing. And that includes Alzheimer's, Parkinson's, recovery from stroke, cardiovascular problems, recovery from heart attack, heart failure, rheumatoid arthritis, and other forms of arthritis, frailty, sarcopenia, which is loss of muscle, osteoporosis, loss of bone density, type 2 diabetes, and certain forms of renal failure, and even macular degeneration. All of these have an inflammatory component, and since regenerative medicine quells and works against, helps to suppress inflammation, it's working to suppress the effects of these disease processes and therefore can slow and stop and possibly reverse the diseases. Other uses of MSC-derived exosomes include cosmetic, as I mentioned earlier, follicle salvage for hair restoration, facial and skin rejuvenation, the sexual functions, bone density, and that could also be for fracture healing. We have some people with poor bone density, they break their hip, they have trouble healing because the bone has very little life in it, and that life is through cells, stem cells. And even through bone necrosis syndrome, you've heard of a famous athlete who may have what's called avascular necrosis. There are wonderful scientific studies, include one from Dr. Hernigau, who showed how to reanimate that dead bone. And muscle mass improvement, whether you have IV or direct, which is really helpful in the elderly and frail. And help in prevention, and this is biohacking health span, helping to slow, prevent, reverse inflammatory processes that contribute to disease and age, and vice versa, and working towards achieving optimal health and cellular performance, which is another way to prevent and slow the onset of any disease or age changes. So what's coming? I promised we'd talk about that because we have some projects in the hopper too, and these will be through designer or specific types of exosome, like tissue-specific exosomes, some that will deliver mitochondria to cells that need it more. So mitochondria have additional benefits beyond just being the energy producer of the cell. And for example, the difference between white adipose tissue and brown adipose tissue or baby fat is that brown tissue is high in mitochondria. When you exercise, you can burn it quickly. So think about converting white fat to brown fat through exosomes so you can burn it quickly. It might help with weight loss and obesity. We can use that to improve muscles, and it might help with certain diseases of a mitochondrial variety. I also see and working on a project with certain types of immune cells that are known to identify and kill cancer cells without hurting regular cells. And if we can separate those out and use them potentially as an augmentative cancer treatment, that's coming very quickly. I've got spending a lot of time on that. And then there are other stem cell lines. Remember, all these exosomes we're talking about are derived from mesenchymal stromal cells, sort of structural stem cells. Well, what about neurologic stem cells and other types? Well, those are coming as well. Those can be used for even better benefit in regenerating spinal cord injury and that kind of thing. And there's so much more to talk about. I hope you come say hi at the booth. Regenerative medicine is not just something in the future. It's here now. You do not have to leave the U.S. to have it. I will remind you that it's not yet approved for marketing claims, so I can't tell you I'm treating or curing a disease or condition, so I can remain compliant and do the right thing as long as you're okay with that. Thank you very much for listening. I'm looking forward to some great questions.